disorders of either congenital or acquired disorders with each of these different ones. Okay, so if we look at inherited hemostatic disorders, basically, if you have an inherited disorder, how soon will you see bleeding problems? Very soon. They're very young, aren't they? So basically, animals will present with bleeding symptoms at a very young age. Now, if it's a mild disorder, in other words, they don't have a severe problem with it, you may only diagnose it until when they become adults, or as you basically, if you have trauma or surgical procedures that they're exposed to, then you can basically see it then. Very often, the very mild disorders may never be diagnosed as far as the animals are concerned. Now, as far as these inherited, more commonly recognized in dogs, doesn't necessarily mean that they're more common in dogs, but as far as our clinical presentations, we see most often in dogs, relatively rare in horses and cattle. They do occur in cats, but are less frequently detected in this species because the cat seems to be able to tolerate these problems a little better before they'll show any significant bleeding. So they actually have probably more incidence of these disorders, but they don't show severe signs with it, so we don't diagnose them. Okay, the most common inherited disorders are your von Willebrand's disease and your coagulation factor deficiencies. As far as inherited disorders of blood vessel wall, platelet number, platelet function, and inhibitors, they're relatively rare. Now, inherited defects involving the vessel wall include the Ehlers-Danlos syndrome and Marfan syndrome. Y'all heard of both of those? Okay. Well, we know that the Ehlers-Danlos syndrome is also known as cutaneous asthenia or rubber bumper disease, and it's very uncommon, but it does occur in inherited connective disorder, and you've got very loose, hyperextensive, fragile skin. You've got to be very careful when you examine an animal with this, is that if you should have a hold of their skin and they should move real quickly, you can rip the skin right off of them. And again, that's not very good to do in front of a client. Okay? It's recognized in both dogs and cats, as well as in humans, mink, cows, sheep, and horses. And basically what the problem is there's a defect in the synthesis and or maturation of your type 1 collagen. You all know about type 1 collagen, right? It's present in blood vessels and all this type of thing, right? So as a result of this interference, we have a loss of vascular support. So the vessel walls are very fragile, and what happens when you have fragile vessel walls? You get bleeding. And that's basically what we'll see. Usually subcutaneous hematomas seen in the animal and very prolonged bleeding time. This is just a dog with rubber puppy or Ehlers-Danlos. You can see how the skin is just hanging, and that's not his normal presentation as far as under his neck is concerned. That's very, very loose skin. He doesn't look too bad about it, does he? But this is what we see with this. Marfan syndrome is a genetic defect in fibrillin, which is the smaller fibers. That's in humans and cattle. And what the problem is they will usually develop aneurysms in little minor vessels like the aorta. And what can happen to aortic aneurysms? They can rupture, and what can happen to the animal? They can bleed out and die. Okay? And you also can see it in the pulmonary artery. You can see it in various vessels, but these are the main ones that cause the biggest problems. And basically, you can see the picture here. There's aneurysm over here, it's bled out, pushed up. That was in the aorta. So you can see that these animals and humans with this condition may not survive very long. Now, there are some inherited quantitative platelet disorders. What's quantitative mean? Number or amount. Okay. And so inherited disorders of platelet numbers are rare compared to a lot of other things. But remember that cyclic hematopoiesis we talked about before with gray collies? Okay, that's going to involve basically all the cells from the bone marrow. And so it's an autosomal recessive disorder. You get cyclic fluctuations in the number of circulating neutrophils, reticulocytes, and platelets, as well as a result of a defect in the hematopoietic stem cells. And so basically, when the neutrophil count falls, they're more susceptible to infections. When your platelet counts fall, they may not all be at the same time. In other words, neutrophils may be one time, platelets another, or they may occur at the same time. The more often they occur at the same time, the more devastating it is as far as the health of the animal is concerned. Now, certain dog breeds, such as your Cavalier Kings, Charles Spaniel, and your Greyhounds, they normally have lower platelet counts than other dogs. So you sometimes they're misdiagnosed as having a thrombocytopenia, but they really don't, because it's just they have lower numbers to begin with. Now, disorders of platelet function are called thrombopathias, also thrombocytopathy or thrombopathy, and they're more commonly recognized in dogs than in other species. One of the most important, of course, is von Willebrand's disease. That is the main inherited thrombopathy that we have. And basically, it's an extrinsic platelet function defect. In other words, it's not involving the platelets themselves, but it's involving their ability to adhere to damaged endothelial cells and damaged basic membrane, this type of thing. So if you have a very young animal with a bleeding disorder, but your coagulation testing results are normal and everything, that would be the next thing that you would think of, would be von Willebrand factor. Now, if the animal has normal von Willebrand factor results, then it might be another type of inherited thrombopathia. But again, this means these are intrinsic platelet function defects predominantly. What's intrinsic mean? What's intrinsic mean? Within the platelets themselves. Okay? And basically, if you've got a breed that is known to have these, then that increases the probability this is what they have. And this, you can't really do anything for these animals. You have to send them to an institution that specializes in doing this, that maybe one is researching this type of thing. And here I come to your inherited qualitative defects as far as the intrinsic. These are the congenital thrombopathias. And the intrinsic, what do platelets have to do? They have to adhere to each other, right? They also have to aggregate. If you have one platelet coming in, what does that one do? So they have to aggregate, and then they secrete. Remember, they have those granules inside of them that they have to secrete. So some of these inherited thrombopathies may involve one of these factors, or they can involve multiple of these factors. Your extrinsic defects are an adhesion, that's mainly von Willebrand factor, and also an aggregation. And that's usually by thromboxanes and fibrin that causes that. Now, as far as some of these qualitative disorders, these are the main ones that we see. Doesn't mean they occur with a whole lot of incidents, but Shiitake-Gashi, you all know that, right? As far as mink, cow, and mice. Canine thrombopathias in the basset hound. Spitz thrombopathia, which is in the Spitz dog. Bovine thrombopathia, which is in Simmental cattle. Thrombocythemia thrombopathias is in otter hounds. Landsman's thrombocythemia is in Great Pyrenees, and then your cyclic hematopoiesis is in the Great Collies. Now that doesn't mean they can't occur in other breeds, but these are the only ones that we can document that there is increased incidence as far as these problems are concerned. I still say you gotta work on that sneeze. I mean, it sounds like you're eking because of the mouth running across the board up there. Now, as far as congenital extrinsic, again, von Willebrand's disease is the most common of these. So let's look at the Shiitake-Gashi. I've seen that picture before, right? The smoke blue version there. Remember, it's an autosomal recessive genetic disorder, and you have abnormal granular formation, and all those blood cells just have granules. Does that include platelets? Yes, we're going to see through granules in the platelets. As far as your platelets in these animals, they lack those discernible dense granules, and they have a deficiency or reduced storage pools of your ATP, serotonin, and diabetic cations. So if you have all that, it just basically totally interferes with the ability of these platelets to do what they're supposed to do. It has been identified in the line of the Persian cats with the smoke, blue smoke. I'm not sure they get blue smoke out of that, but they call it blue smoke, hair color, and pale irises. And they also will have bilateral nuclear cataracts in several of these individuals that goes along with this defect. Now, as far as the affected cats, they will have prolonged bleeding at incision sites. They will develop hematomas following venipuncture. They have prolonged buccal mucosal bleeding times, abnormally large granules in the peripheral blood granulocytes, as you see here, the neutrophils. And this condition is also, as we said, been diagnosed in mink, man, mice, cattle, like Hereford, and killer whales, and it's basically albino individuals. The albino trait in these. Now, canine thrombopathia is an hereditary intrinsic platelet disorder. It's been described in the Basset Hound and in the Spitz dogs. You see the pictures here. How it's inherited, they do not know. They have not been able to figure out the precise inheritance pattern, but it is unique to dogs and it doesn't appear to have a human counterpart. As far as these animals are concerned, in the Basset Hound, you will see the petechial hemorrhages, oral hematomas, prolonged hemorrhage during estrus, shedding of this, and when they shed their teeth, and also after trauma or surgery, you will see prolonged bleeding. And it's characterized by decreased platelet retention and absent platelet aggregation to all agonists. In other words, when they test platelet function, they combine these platelets that they've isolated with different compounds that normally cause aggregation of platelets, and if they don't aggregate, it means that they lack this ability as far as these platelets to respond to these aggregation agonists. Now they will react with thrombin though, but there is a very delayed onset and reduced rate. Okay, shape change as far as the platelets does not occur, does occur. In other words, they can bind around each other. And clot retraction is normal, but they just don't work very well. So the animal will get these bleeding problems. Now the precise defect in this animal is not known. It may involve the cyclic AMP metabolism, so they don't have the energy produced to be able to do everything they're supposed to do. They have some increased basal cyclic AMP that inhibits intracellular calcium release, agonist receptor binding, and agonist-induced phospholipid hydrolysis. So if they don't beat it, what can they not do? And they basically cannot aggregate properly. And if they can't aggregate, what does that do to the ability to form an efficient platelet plug? You don't have it. It's in there. Now, in the Spitz, the infected animals exhibit chronic intermittent mucosal bleeding at a young age. And again, the mechanisms behind this are the same. Bovine thrombopathia is an autosomal inherited platelet function defect that we see in Simmental and Simmental cross cattle, which is kind of all your coagulation disorders. Usually, if you have a crossbreed, what does that usually mean about genetic disorders? You don't usually see them as much. I don't see them. But with the coagulation problems and platelet problems, you do see them in the crossbreeds. Okay? And the diagnosis is usually made between 2 weeks and 3 years of age, and basically ear tagging, branding, tattooing, dehorning, parturition surgery, all those different things. That's when you're going to see bleeding episodes of the animals. Now, the findings can vary from epistaxis, hematuria, hematomas, prolonged estral bleeding, and lameness, because anywhere where you have a lot of pressure on vessels, you can get bleeding, and this is very true in the feet, so subsolar vessels and stuff like that, so you get hematomas down there. Your coagulation profiles, your platelet counts, and platelet concentrations of ADP, ATP, and serotonin are all normal. Okay. There's an abnormal platelet aggregation in response to collagen, ADP platelet factor, the activating factor, calcium ionophores, and thrombin. And so basically, everything seems normal except the platelets do not aggregate properly. And if they can't aggregate, what does that do to their function? It doesn't work very well. Now, a defect in calcium mobilization and a variant von Willebrand factor have been implicated in what the pathophysiology of this particular disease, but they have not had enough cases that they can prove that that's it.
Mention again why the serotonin is important. It's not important.
Well, serotonin, what does it do to blood vessels? It will mostly cause basically what it does, it constricts some and also will dilate the other ones so that it won't completely diminish the blood flow to the area that constrict those that are coming into that area that's bleeding. It will cause dilation of the other vessels so that they can take the place and help out as far as bringing nutrients and things to those areas. Serotonin can also activate the ATP active system to get energy and this type of thing. And it also will cause some of your nerve reaction, which will cause constriction and stuff like that in vessels. Okay. Now, Glanzmann's thrombocythemia is also called thrombocytic thrombopathia. Say that 3 times real fast. And it's an autosomal recessive inherited platelet disorder recognized in your Otterhound, top there in the Great Pyrenees. The defect is basically due to an absent or dysfunctional glycoprotein 2B, 3A on the platelets, and basically this is the receptor, and it's the receptor for fibrinogen. Remember, fibrinogen helps to basically activate things with the platelet function. It helps to clump the platelets together, this type of thing, and so the platelets won't aggregate very well. Again, if you can't aggregate, you can't get effective clotting, because you lose that. Now, the animal won't have a lot. It can. Why does the animals live? If they can't clot blood, how do they live? Remember, the fibrin, the coagulation cascades will still be activated. And they will come in and close the defect, but they're not going to be nicely packed. So you're going to have little leaks in them because the platelets weren't there to give the scalping for them. So that will stop massive bleeding, but you'll still get petition hemorrhages, all this type of thing, ecchymotic hemorrhages. And if you get enough of this, it can cause death in the long run. Now, as far as these animals, they have prolonged bleeding from minor wounds, they have spontaneous epistaxis, and rarely form hematomas at site of injury or vena puncture. Now, what will usually happen when they form these hematomas, after the animal, after a little while, the hematomas will go away. If it's a coagulation disorder, those hematomas come back. With this, they're not going to come back unless you do another vena puncture. They have a normal to mildly decreased platelet count, a normal to increased mean platelet volume, and a prolonged buccal mucosal bleeding time. Okay, so basically, since they can't aggregate, it's going to cause more bleeding when you do your bleeding test. And again, they don't have granular activity that's very good in them, so they can't do what platelets are normally supposed to do, and that is aggregate, form shape changes and everything, and form that scalpeling for the fibrin to be degraded or to be deposited on to give you your fibrin clot. Shape change does not occur in these platelets, and so how effective are they going to be able to make a primary clot if they can't shape change? I mean, if you want to make a bunch of stuff, it's easier to just mold everything together, right? And that's basically what shape change allows them to do. If they can't do that, then you have gaps in them. When you have gaps, you're going to get more bleeding, this type of thing. Now, clot retraction is abnormal, and this helps differentiate this disorder from Basset-Hound thrombopathy. Although if you're talking about Basset-Hound thrombopathy, if it's a Spitz, or if it's a Great Pyrenees, rather, if we have trouble saying this is not Basset-Hound thrombopathy, if it's a Spitz. But anyway, but there is some, in other words, what you're saying, these diseases can occur in other breeds, but they're basically called the main breeds you can see them in as far as their names. It doesn't mean that the Basset-Hound thrombopathy only occurs in Basset Hounds, but that's the one that is most often recognized. Now, von Willebrand's disease, it's the most common inherited disorder of hemostasis in both humans and dogs. Now, this has been described in over 65 breeds of dogs, including mixed breed dogs. It's also been described in pigs, rabbits, cats, and horses. This is just a few of the more common breeds, dogs that we see this in. Of course, what's the first one? The Doberman. Why do you think the Doberman was one that was first recognized with this? Well, the problem is whenever humans, about several years ago, this was the most common breed, right? Anytime an animal gets to be the most common breed, they're destined to be doomed. Because the humans start breeding when they see these, I like this little dog right here, I'm going to breed this little dog. And so when they breed recessive traits, this type of thing. And that's why you have an increased incidence and genetic disorders in them. And you can basically almost wipe out the breed. We've almost wiped out the Doberman breed. And then we like German Shepherds. What do you think happens? Same thing. And so, it's just a problem as far as humans. Oh, they're so cute. When they're real cute like that, when they're big, what does that mean they've got? In fact, there's genetic disorders, okay? You shouldn't breed them. Now, as far as von Willebrand's disease is concerned, as we said, it's impaired platelet adhesion, and it's secondary to abnormalities in von Willebrand factor. It can be quantitative or qualitative. You may have it, but it's not functional, or you may not have much of it to begin with. And remember, this is an extrinsic platelet function defect. It's not inside the platelets. Okay. It's generally characterized, as we see, by prolonged bleeding time, and you're going to have low levels of plasma hemoglobin factor and also factor VIII. Why do you have low levels of factor VIII? What's the relationship between factor VIII and hemoglobin factor? And the factor VIII uses hemoglobin for protection. So if you have less protection, what's going to happen to that little small factor VIII molecule? It's going to be destroyed. Okay? And what you're going to see with this, though, is since it's not going to take this factor VIII below the 30% necessary for effective animals, you're not going to see any prolongation of your APTT or PT test. It will be normal. Coagulation screens will be normal in these animals, except for very rare, sometimes an animal or human may have enough decrease in its factor VIII to cause problems as far as the APTT is concerned. Now, in most cases of von Willebrand's disease, your platelet counts and all your coagulation screens are normal. That's one way we narrow down that this might be what the problem is. It has a close association with hypothyroidism. Anybody have any idea why? What's one of the functions of thyroid hormone as far as membrane stability? It helps your membrane stability, so it probably helps as far as the ability of the cells to release or maintain your hemoglobin factors and or release them what's necessary. Okay, hemoglobin factors present in fibroblasts, it's also present in platelets and endothelial cells. And so one of the treatments sometimes that will help as far as von Willebrand's disease is to give thyroid hormone. But unfortunately, if the animal wasn't hypothyroid, you give thyroid hormone, what would you make that animal? Hypothyroid, because you're getting thyroid hormones. What's the thyroid going to say? I'm going on vacation. If it goes on vacation long enough, will it ever come back? No. So there's a problem you have to worry about. But one of the problems you'll see with hypothyroidism is bleeding disorders. And so treating with the thyroid hormone can sometimes get rid of those bleeding disorders because your hemoglobin factor returns to normal. Now, the inheritance pattern as far as von Willebrand's may be autosomal dominant inheritance, incomplete penetrance, or autosomal recessive. Now, if you look in here, these are the different types. We said 3 recognized forms from type 1 through 3. Now, type 1 is a low concentration of normal hemoglobin factor. That's the least severe of it, but it is, if it's low enough, it can cause problems. And this is seen most often in Doberman pinschers, your Shetland sheepdogs, and other breeds of dogs. That's why they live. Okay. Type 2 is a low concentration of abnormal hemoglobin factor. And this is seen in German short-haired, wide-haired pointers, and also reported in a quarter horse. Now, what do you think the worst of these would be? What about type 3? What does that tell us? We don't have any hemoglobin factor. So this is by far the most severe form of it. It's in Scottish Terriers, Shetland Sheepdogs, Chesapeake Bay Retrievers, the Dutch Philo dogs, pigs, and a monkey have been reported in. Now, as far as your clinical manifestations, of course, you're going to see petitional ecchymotic hemorrhages, mucosal bleeding of the gingiva, the GI tract, the urinary tract. So what are you going to see in your urine? You're going to see hematuria. Okay. What are you going to see in your GI and your feces? About melena, and also some frank blood that goes throughout the tract down there. And you'll see epistaxis. Now, a screening test, basically, what's the main screening test for any hemostatic disorder? The bleeding time. So the buccal mucosal bleeding time is the preferred one. As far as diagnosing von Willebrand's disease, you have to measure von Willebrand factor levels in the animal. Okay, and there is a snap test that you will use to do that. As far as treatment, what's DDAVP? Anybody? Desmopressin, acetate. What else did we use? What else did we treat with DDAVP? Anybody remember? Endocrinology? No? Diabetes insipidus. Remember, it has the same function as ADH does. Okay? But it doesn't have the, ADH, has both the antidiuretic and also antipressure. The DAVP doesn't have that antipressure effect, so Would you want to be giving a drug to an animal that causes extremely high blood pressure? No, that's kind of not doing very good, is it? So the DDAVP does not have those, since it's arginase in there. Replace that, replace the amino acid with arginine on the chain, on the receptor site there. So you don't have as much of the pressure effect, but you do have ADH effect. So as far as DDAVP, it will cause a massive release of von Willebrand factor from endothelial cells. Is this going to be used for treating type 3? Does type 3 have any von Willebrand factor? So it's not going to work in there. In fact, the one thing you can do basically for your type 3 is to give your precipitated plasma to it on a routine basis to give it von Willebrand factor. Okay, and that's usually not economically feasible. Okay, this can be administered to, let's say I have a dog I know has von Willebrand disease and I have to do a surgical procedure. We want to just go ahead and do that surgical procedure. So if we give this dog some of this, DDAVP, if they don't have type 3, then giving that will increase their levels of von Willebrand factor in the blood. Or we can give it to the donor animal and give this animal donor blood during the surgical procedure. If we give it to the donor animal in advance, that will greatly increase the von Willebrand factor in that blood that we collect from that donor animal. So we can do that. Okay. Unfortunately, lots of times we may not know that these animals have this problem, and it's a very good idea, very nice to be able to diagnose that they had a bleeding disorder after they bled to death when we do the procedure on them. So basically, you've got to get a good history, and if they had any bleeding abnormalities from their history, then you need to basically do a pre-screen for the von Willebrand factor and see what we've got. Okay. Now, as far as the treatment, again, the source of DDAVP is precipitated plasma, fresh or fresh frozen plasma or whole blood. Can also be a source as far as your von Willebrand factor is concerned. And so again, with type 3, we can't use DDAVP. So we're going to have to supplement that animal with von Willebrand factor before we do any procedures on it. And we also may have to do that if it's in a crisis to give this. Now, as far as using whole blood, that should only be used if the animal is hypoxic and has, basically low blood volume, this type of thing. Because is it a good idea to give it a whole bunch of blood if it doesn't need blood? Can that cause overwhelm the system and everything? And that can cause death. And what have I told you about treatments and things? But you don't want to kill the animal with them, right? Now, let's say if you're anatomical pathologist, you may look forward to that, but you don't have to do that, right? Okay, now as far as other inherited disorders, there are of the coagulation cascade. What's the most common, we said the other day? What's the most common inherited coagulation pathway disorder? Hemophilia A, what's that? Factor VIII deficiency. Now, as far as these inherited deficiencies of the coagulation factors in the coagulation cascade, they do occur in animals like they do in man. And there are some deficiencies of basically the intrinsic pathway is the most common. 12 is by far the most common. That's called Hagen's disease, mainly seen in cats, but that doesn't cause bleeding. So we usually don't have much problem with that. Factor 11, not as common. 9 and 8. 8 by far the most common. Where 8 is hemophilia A, 9 is hemophilia B, and 11 is hemophilia C. Okay? But those are the most common of coagulation disorders.
Earlier we said that factor 8 is most common, but then I just heard it's like factor 12 is most common. That only
no, factor 8 is the most common that causes problems. Okay. Factor 12 is, remember, that's at the top of the intrinsic pathway. It's not really involved in activating the cascade in vivo. It's mainly involved with activating the plasminogen system and the inflammatory things. But the one, when we're talking about the most common, we're talking about what we're presented with because of a coagulation disorder. Okay. Now, some of these diseases are sex-linked, so the gene is on the X chromosome, and they usually only occur in males. But what if I breed a carrier female with an infected male? What am I going to get? I'm gonna get some infected females in that. Yeah. Now, as far as these deficiencies of the coagulation cascade, besides the factors, there can be a prekallikrein deficiency. You know, I had prekallikrein stuff and pathology, inflammation and stuff. Okay. Also, it's factor 12 deficiency, which again is known as Hageman's disease. Factor 11 deficiency, 9 deficiency, 8 deficiency, factor 7 deficiency, factor 10 deficiency. There's a prothrombin. What factor is prothrombin? 2. And abnormalities in fibrinogen, either dysfunctional or lack of, and vitamin K deficiencies. These are the most common deficiencies that we see. Okay. Now, this is showing you your pathways, right? Basically, where these different things, and you need to know that. What the pathways are and where these factors are located in the pathways. Okay? So, prekallikrein. That's Fletcher factors, another name for that. It is a proenzyme that circulates in the plasma in a complex with high molecular weight kininogen, and it's converted to kallikrein by factor 12. This is activated factor 12, that's why it has the A after it. It enhances the activation of factor 12 and converts, forgive that symbol, I don't know what happened, but high molecular weight kininogen, take those two things out in the middle of that thing there, and into bradykinin. And this is an important mediator of vasodilatation, inflammation, fibrolysis. Why do you want to have vasodilatation when you're doing this? Okay? If you're bleeding, you're going to constrict that vessel, right? So what do you have to do to the surrounding vessels? You're going to dilate and replace that blood flow, aren't you? Bring it in there. Inflammation. The inflammation, is that going to cause some of the healing response to start occurring? So that's why we don't do that. Fibrolysis, do you want that clot to stay around forever? No. So that's what we have in here. Now, a deficiency of your prekallikrein does not cause a clinically apparent coagulopathy, but it can result in a prolonged APTT because it can affect, if you have a deficiency, it probably means you have factor 12 problem. You'll see that, okay? Now, these are some of the animals this has been reported in: a family of Belgian horses, a family of miniature horses, and 2 dogs. So in other words, what does that tell you about the frequency as far as this condition is? Very rare. That's why we have to know about it. Because guess what your first client's going to have, patient's going to have, you're getting practice. Something nobody ever reported in that animal or something, right? So you got to be familiar with what can be there. Okay? Now, as far as factor 12 deficiency, again, it's called Hageman factor, and it is a serine protease, which is what most of these factors are, and it is activated to 12A by contact with a negatively charged surface, in other words, the subendothelial basement membrane. How did you get a subendothelial basement membrane? What happened to the endothelium? It was damaged, so it exposes that negative surface there. Also, it protease induced enzymatic cleavage. In other words, kallikrein and plasmin are going to help activate more factor 12 to keep this whole process going as far as fibrolysis and everything. Now, it can activate 11 to 11A and prekallikrein to kallikrein, but you don't need it in the animal's body to activate factor 11 for the coagulation cascade. That's why factor 12 deficiency usually does not exhibit clinical bleeding. But the reason we see it belongs with our APTT, because that's where our test is designed to start at factor 12 level. Okay? It, as we said, non-associated clinical bleeding does prolong APTT, and individuals that have factor 12 deficiency, it can be, and so remember it causes the activation of the inflammatory system. If you don't have the inflammatory system and you've got this defect, and that bacteria and stuff get in there and everything. So one of the problems is these animals will be more prone to have infections. Also, it activates the fibrolysis system. What if you don't activate that? What can you get? Thrombosis. And basically, if that stays in the vessel, what's going to happen to the tissues downstream? You'll get ischemic necrosis and this type of thing. Basically, factor 12 deficiency has been reported in cats, a German short-haired pointer, a standard poodle, and a family of miniature poodles. And here's pictures of the animals. I like poodles all right, but I just can't see those flip jobs there. I mean, that's a little much as far as I'm concerned. Y'all may like it, but doesn't look like a dog. Okay. Now, factor 11 deficiency, again, it's a serine protease that circulates in the blood in complex with high molecular weight kininogen, and it's activated to factor 11A by either factor 12A, which is uncommon, or 2A. What's 2A? Activating what? Which is? Well, thrombin is activated. So 2A is thrombin. So in other words, thrombin then, once it's formed, it will go back and, in other words, generally the intrinsic system comes a little bit later. Extrinsic system activates first. Is that good or bad? How many factors do you have in the extrinsic system? You have one, right? Is that going to take a lot of effort to get that activated? And a lot of time? No, it can activate very rapidly. But it will go down and activate, your common pathway gives you factor 2A. And once you start that, that will go back and get the intrinsic system going and keep it going until the clot does what it's supposed to do. Okay, so they interact throughout the different pathways. As far as factor 11 deficiency is rare and recorded in dogs, the Springer Spaniel, Great Pyrenees, Weimaraner, Kerry Blue Terriers, also in Holstein cattle and in man. Now I didn't put man up here, but you all know what this breed look like, okay? But anyways, this is just showing you your different species that this has been associated with in breeds. Okay. Now, as far as dogs that have a severe factor 11 deficiency of hemophilia C, they're going to basically have minimal bleeding unless they're subjected to trauma or surgery. So what does that tell you? If you only have minimum bleeding, what does that tell you? Is it essential to have factor 11 to get coagulation? It's not essential. In other words, you can activate the pathways at factor 9 level. Okay, but it's not going to be quite as efficient as going to factor 11. So you'll have minimal bleeding, but not profuse bleeding unless they're exposed to surgical procedures or to trauma or something like that. And your affected individuals are going to have levels of factor 11 less than 30. Remember, between 40 to 60 is carrier, less than 30 is affected individuals. And what's that going to do? Are you going to prolong APTT? That's in that intrinsic pathway, right? And you're also going to have possibly a prolonged activated coagulation time. Now, the mode of inheritance is autosomal, so both males and females can be affected. So it's not sex-linked as far as this is concerned. Now, in cattle, factor 11 deficiency is inherited as an autosomal recessive trait, as similar to what the problem seen in man and dogs, but cattle rarely show spontaneous bleeding. But again, if you have trauma or surgery, such as dehorning or this type of thing, then these animals can demonstrate bleeding. This is a problem. Now, in human patients with hemophilia C, basically your hemorrhage has been mainly attributed to excessive fibrinolysis. If you lyse the clot too quick, what's going to happen? You're going to continue to bleed. Now, with factor 11 deficiency, your coagulation cascade is not amplified by thrombin. In other words, thrombin won't come back and activate and keep it going. And small amount of thrombin generated by the extrinsic pathway is insufficient to basically keep this condition going. You're not going to basically, if you don't have enough of the extrinsic pathway going in there, it's not enough basically to activate tissue factor pathway inhibitor, which are basically these different things. And so you don't activate fibrinolysis of clots, and so you will get basically thrombi, emboli, and all this stuff happening too. So it's a kind of combination of bleeding, but it's also a combination of thrombosis and this type of thing happening. Factor 10 deficiency, that's Stewart-Prower factor. Again, it's a serine protease. It is vitamin K. What are the vitamin K dependent factors? If I ask you a quiz right now, what would your answers be? 2, 7, 9, and 10. Okay. And basically now, where is factor 10 located? What pathway? The common pathway. So we have a factor 10 deficiency. Will APTT be prolonged? Yes. Will PT be prolonged? Yes. Okay. So basically, If factor 10 is not working, what's going to happen to making a clot? Is that going to happen? No. So in other words, how common do you think factor 10 deficiency is? Can you live very long if you're bleeding all the time? So factor 10 deficiency is not that common because the animals usually don't live long enough to be able to diagnose this problem. Okay? Now remember, factor 10 is activated factor 10A in combination with factor 5, and that is what converts factor 2 to factor 2A, or to thrombin. Okay? And again, this factor 10 forms a complex with factor 5 is called the prothrombinase complex, and this involves platelet phospholipids, factors 5, factor 10 going together, and also prothrombin working together. So we keep forming this complex. So rare hemorrhagic disorder, as we said, because it's rare because they don't live very long. It's been described in a family of American Cocker Spaniels, and for some reason they can survive for longer times with this. It's just not real severe. It's also been seen in a female Jack Russell Terrier and a male domestic short-haired cat. Notice a male domestic short-haired cat, a female. What does that tell you about the incidence? Rare. Now, it doesn't mean it's haven't been a little more than we've seen, but these are the ones we've seen clinically. Now, in the Cocker Spaniel, there is a very high neonatal mortality rate. You're going to have some severe hemorrhagic tendencies, of course. If they have levels less than 30%, of course, you're going to have prolongation of all your different coagulation screening tests. And so, can you cure it? So if you diagnose it, what are you going to have to do? Treat it. How long? For life. Okay, and so basically treatment to control bleeding is going to have to be IV infusion of fresh frozen plasma or cryosupernating. What's cryosupernating mean? So what's it mean by fresh frozen plasma? You froze it, right? Now, is there stuff in there besides what you may want to give as far as coagulation disorders? So what do? You partially thaw it. The coagulation factors will stay frozen longer. So you partially thaw it, you pull off the supernatant, and what you have left is a very high concentration of your coagulation factors. Then what do you do with it? Bring it to body temperature and then give it to the animal. You want to put it in a water bath and boil it? What's going to happen to those factors if you do that? They're going to be denatured and everything. Okay? So as far as the inheritance pattern in the Cocker Spaniel is autosomal dominant. What does it mean when something's autosomal dominant? What's the incidence of the occurrence of it? Very high. And it has variable penetrance as far as genes are concerned. Okay, now factor 11, or excuse me, 9 deficiency, I get much about it. Y'all need to know your Roman numerals before the next exam. Okay? Factor 9 deficiency is also factor hemophilia factor B, or hemophilia B, or it's also called Christmas factor, which I'm not real sure why, but it's Christmas factor. It's also serine protease, it's also vitamin K dependent, and it's activated to 9A by 11A, and what's necessary to do that is calcium. So what have you said about calcium? Is it necessary for coagulation to occur? Yes. Is that one reason we don't use the plasma from an EDTA sample to do a coag screen? Because remember, that's excessive EDTA. What's it going to do to the calcium? Or bind it. So what's going to happen to the coagulation screens? It's not going to form a clot, so we prolong. Okay? And that's why we use the citrate, because that reversibly binds it, and with that proper ratio we put in there, our rages of calcium in there, which will give us enough calcium to run these assays. Okay? Now, as far as factor 9 deficiency, it is sex-linked. It's an X chromosome linked hemorrhagic factor, and it's basically going to give you the same clinical presentation that factor 8 deficiency does. Both of them would do that. Okay. Now, the disorder primarily affects males, as we said. What do most sex-linked things usually affect? Males. Oh, I'm sorry. That's the way it goes, right? All right, and in closely inbred families is where you're going to see, so you can get homozygote females may be produced by mating infected males, we say, to a carrier female. What limits this occurrence? How long will a lot of these male animals live when they got this disease? They may not live too long, so can they have time to breed? No. Now this is you'll see it more common in small breed females. Why? What animals can withstand these defects back longer? A big animal, every time it walks, it gets a hemorrhagic episode, or small animals that don't lose much weight on things. So your smaller animals can more often be seen with these as far as females are concerned. Also cats. They can have these defects and not be as bad as the dogs and stuff because of their light weight. Now, if you've got one of these acrobatic cats that jumps off the ceilings and stuff like that, it's different. Okay, now as far as the factor 9 deficiency, as they say, it's not as common as factor 8 deficiency or hemophilia A, but it's been described in one mixed breed dog, which again is strange as far as mixed breeding is concerned, and in many purebreds. This includes Labrador retrievers and German Shepherd dogs. If I ask you on a test, what's the most common breed associated with these conditions, what you usually have pretty self-assurance is going to be German Shepherd. It's also been recognized in the family of British short-haired cats and also many Siamese cross cats. And again, here's some pictures of them right here. Okay, wouldn't you just love to have all those cats down there on top of your bed?
Yes.
How many of you are cat lovers?
Don't know.
How many of them want to have a cat if they were you? Someone gave $1 million to take it. I don't know about that. If somebody gave me $1 million, I love cats, but if I didn't like cats, and somebody's out, give me $1 million if you adopt this cat. I'm sorry.
How long do I have to keep that for?
Whatever. Until you spend all the $1 million.
An hour.
Okay, now as far as your factor 9 deficiency, when you have severe deficiency where there's less than 1% of the factor there, then your animals, your puppies or kittens can die immediately after birth, or they may be born dead. Because again, what has to break is the umbilical cord, right? And what's that umbilical cord supposed to do? It's supposed to clot, right? And if it don't clot, they can bleed out from that. Also, you can get excessive bleeding when you clip the dew claws or things like that. When if it's an animal that you're going to dock the tail in, you see that with that. And you get hemorrhoids. What's hemorrhoids? Bleeding into joints. You can see now, is that going to be very painful? Yes, it is. And also gingival bleeding during tooth eruption and spontaneous hematomas from basically just bumping into something. Or if you got a couple of young puppies playing with each other, they're going to be roughhousing and everything. And so you can see spontaneous hematoma with that. Now, individuals with levels between 5 and 10% may not be recognized as having a problem until they're challenged by either trauma or a surgical procedure. That's why you need to get a very good history. What if you ask the owner, well, this owner's had litters with this of this same breed. He said, have any of your litters ever had trouble with bleeding and stuff? They tell you yes. Are you going to go ahead and do that surgery, or are you going to do a coax screen before you do that surgery? And if that screen has a prolonged APTT, what are you going to do about the surgery? If it's elective surgery, you're definitely not going to do it. If it's something that you've got to do, then you're going to have a good supply of the plasma available, precipitate plasma, this type of thing to use. Okay. Now, again, as we said, small cats small dogs and also cats may go basically unrecognized as having a bleeding disorder until they're subject to trauma or surgical procedures or something. And that's because of their lightweight, and if it's if these people who love their cats, keep a little baby cat, in their bed at night and everything, don't knock it out, the bed and stuff, so they never show clinical signs. Okay. Now, as far as most affected individuals will have a prolonged APTT, as we said, but what other things can cause prolonged APTT? Well, if you have a normal PT and a prolonged APTT, where's our problem? Intrinsic, is that one factor in the intrinsic? So how am I gonna know which one I got? It's the best way to know if you have a deficiency in anything. Measure the levels of that particular compound. So specific factor analysis may be required to give you a definitive diagnosis as far as what you have. And remember, those screens will not be prolonged unless your factor levels are less than 30%. So you cannot detect carriers as far as this. What would be the only way you could detect a carrier? You're gonna have to send the blood off and get specific factor analysis done on that particular animal. And one of the problems with that, you've got to make sure you follow all the directions on how to preserve that specimen, because these factors, they're labile factors. So what's gonna happen if the blood sits around improperly handled? Oh my heavens, I have every factor deficit known to man. But no, it's because they all degraded and stuff, okay? So treatment, again, transfusion of fresh plasma, fresh frozen plasma, cryosupernatant in there. And it's recommended for treating of acute bleeding episodes. They often will bleed internally into thorax or abdomen, between the fascial planes of the muscles, and also into the brain. And so, depending on how severe the bleeding is, when you get the animal in your clinic, there may actually be nothing you can do for it. Okay? And as far as one of the problems is lots of times, if you're bleeding small amounts continuously, you know it right away in an animal. And so by the time that the animal's showing clinical signs, what does that usually mean? Is there a whole lot you can do about it? No. So lots of times, you may not do it. In other words, the prognosis is not very good if there's a crisis, as far as this is concerned. And basically, unchecked hemorrhage over time can result in muscle necrosis, paralysis, seizures, and also hypovolemic shock. Okay, and so are these the only things that'll do it? No, so last time you may not know there's a bleeding disorder causing this whole thing. Okay, we're going to take a break and we're going to come back in 10 minutes and we're going to do the rest of these deficiencies.